Okay, when the last slide that I talked about yesterday, we were starting to talk about acid-base balance. And again, I'm going to get into control of breathing later, but just remember the values that I wanted you to know is normal CO2, and you need to know how it's measured. So it was 40 mmHg, or millimeters of mercury, and normal pH is 7.4. Remember, anything below 7.4 is considered acidotic, and anything above 7.4 is considered alkalotic. I don't get a lot into this class about blood gases, but in anesthesia, I talk a little bit about doing a blood gas, which is when we take an arterial sample. And normally when you draw blood, you're always drawing from a vein for a venous sample. But when you're measuring oxygen concentration in the blood, and when you're measuring CO2 concentration in the blood, you need, the best sample is going to be from an arterial vessel. And in equine anesthesia, it's a gold standard. If you do work with horses, because of the large, size of the horse, the weight on the lungs, oxygenation and perfusion is very key to successful anesthesia. And especially like sick colics, they have a lot of acidosis and acid-base metabolic issues. So this will come up in other classes, is what is the importance of the relationship of pH and CO2. And then obviously in anesthesia, it alters that. So we will come back to that. I do want you to know those values. And part of the other job of the respiratory system is sense of smell, which is olfactory. And deep within the nasal cavity, there is receptors, and that is where the sense of smell comes from. So it's very high and up in the nasal cavity. Now, if you've ever seen your animals do this, and dogs, I've seen dogs and cats do this, and it's kind of strange. Sometimes they sniff and they're like, they use the top of their nose, but sometimes they really put their nose on something and they almost stand up and their mouth is open. They're kind of like, my cats have done it. Sometimes Bo has done it when we've been on a walk. And sometimes when they open up their mouth and they're trying to really smell something, they're trying to bring it back into their olfactory bulb, which is where the receptors are. So that sense of smell is very deep within those nasal cavities. So sometimes, like I said, they do that little sniffing, but if they do this, like where they really sniff and then they almost stand up and their mouth is kind of partly open, they're really trying to pick up the scent, or they've smelled something very, very interesting. So it's something to look at. And the other thing, and I just throw it out there because when I talk about sense of smell, cats, and we were talking about upper respiratory infections, because anytime a cat has a URI, they usually have a very plugged nose, a lot of nasal discharge, sometimes ocular discharge. But cats' appetite is very tied into their ability to smell their food. So a lot of cats that cannot smell, or that, they have a lot of discharge or very plugged nose, sometimes will stop eating. And it's very important that if we have a cat with a severe upper respiratory, periodically we will clean their nose. We'll take like a warm washcloth and try to clean their nasal cavity. But also we need to make sure, sometimes if they're not eating, and I will tell clients this, if they've got a case, I'll say, make sure they have something very smelly to eat, or warm up their food to bring out the smell. Tuna juice, like sometimes I say, you don't have to give them tuna, but you can take a tuna can and pour the juice of the tuna on the food, because anything that's going to make the food more aromatic will help them smell. We had, one of the things we used to radiate, cats can get lymphoma called nasal lymphoma. Lymphoma typically affects the lymph nodes, but some cats would get it primarily in their nose. They would come in completely, the tumor was kind of taking over the nasal cavity. And I had this little cat and she was not eating, like we had to basically force feed her because she could not smell. The nice thing about nasal lymphoma is radiation will cure it, basically. So we did within 2 days, 3 days of radiation, and not all radiation responds as quickly, but this was a cancer that after the 3rd day of radiation, that cat started mowing food. Like, I mean, I put food in and she's almost like a dog that dives in the bowl, which was very satisfying because the tumor shrunk in the nasal cavity. She could start to smell. She got an appetite back. And sometimes appetite stimulants aren't even enough. There are appetite stimulants that we can give animals, but in this case, you know, you got to get them to eat. It's not so much like that in the dog. It seems to be more in the cat that sense of smell is very tied to appetite. And they got to be able to get that smell back there, trigger their wanting to eat. Okay, so we have to talk about the structures. So I've talked about some of the jobs and the structures that you need to know. You need to know, if I give you a structure, you have to be able to tell me, is it an upper respiratory or a lower respiratory structure? Because that's how we divide up the respiratory system. If you think about it, from the time air enters the nose, that's the first place in an animal they usually breathe through their nose. It's going to enter, and it is a series of tubes and passages all the way to the lung. So it's basically an open structure. One of the things I taught you in tissues was anything that is open to the outside environment is lined with a protective mucosa. That is why the respiratory system is lined with that pseudostratified ciliated epithelium, because we know that foreign particles are able to enter, and if they get from the nasal cavity, they could migrate to the lungs. Now, there's lots of things: sneezing, coughing, the cilia trap it, the lining of the mucus. You know, there's a lot of things that are going to try to prevent it from getting that far, but it is an open environment. So it goes from the nose all the way down to the lungs, and it's through these tubes. If I say it's upper respiratory tract, it's anything outside the lungs. Now, the lungs are in the chest, okay? And the trachea is in the neck, and then the trachea divides. The trachea, even though it divides to the lungs, it is still considered an upper respiratory tract structure, because that trachea is going to bifurcate and split. Now, once we get into the lungs, anything that's a structure inside the lungs is lower respiratory tract. That's when we get into the bronchi and the bronchioles and the alveoli. And the lungs are lower respiratory tract. Okay, so anything I tell you outside the lungs is automatically an upper respiratory tract structure. Now, this picture is a picture that you will need to be able to label for the test. So I want everybody to realize this. I'm going to write on here, it's slide 9. Okay, so you'll see this structure and you will have to label it. And I also, like I've done in other things, I may ask you questions of, you know, what is this? So the upper respiratory tract is all of these structures: the nostrils through the nasal passages, the pharynx, the larynx, and the trachea. Is it worse to have a lower respiratory tract, and even though the upper respiratory system is made up of more parts? Yes, Bethany, I would say it kind of depends on the disease, but typically when you have a lower respiratory infection, which is in the lungs, it's usually an infection that has persisted and built, and it's a little bit harder to treat because it can kind of fester. So, you know, I feel like there's a few more things that affect the upper respiratory system, but by the time we get down to the lower respiratory, like pneumonia, is a very serious infection. So, yes, so usually an upper respiratory infection, an upper respiratory infection doesn't always go to the lungs. And I'm going to tell you, you can get a pneumonia without an upper respiratory infection. Well, let me bring up a point. This coronavirus in people is starting out with somewhat upper respiratory symptoms or itchy eyes, a cough, and then it's progressing to a pneumonia. So the coronavirus, in some people, the coronavirus, and it's an atypical pneumonia. It's not the typical pneumonia, but that starts with some upper respiratory systems and then it has moved its way down. Now, if a dog aspirates, I'm talking about anesthesia and the need to fast dogs. Dogs aren't supposed to eat before anesthesia because we worry if they vomit, if they inhale it into your lungs, that is a lower respiratory issue. It doesn't really affect the upper respiratory structure. So it kind of depends on the disease. Does that make sense, Bethany? You can stop an upper respiratory infection can get so bad that the infection takes over the body and it becomes a lower respiratory, but it doesn't always happen. We can sometimes stop it at the upper level, but then you can get a pneumonia that has nothing to do with the upper respiratory system, and it just is lower respiratory. So I will try to bring up a few of those as I go through some of the common diseases that we go, but we're going to break down the upper respiratory structure. So let me look at this picture for a minute with you. What you're seeing here is a cross section of the skull. And now there are digestive structures in this picture. When we do the digestive system is after this section, you're going to see this picture again because, the tongue assists in eating. And then you've got this thing back here called the soft palate. And the soft palate is like a divider. When you look back, and when I showed, there was a video about looking back for intubation, when we were looking at that laryngeal paralysis video, the top curtain, think of it like a curtain, that is the soft palate. And the soft palate divides this whole thing called the pharynx. So see where it says pharynx up here and it's pointing? This whole thing is the pharynx. The pharynx is a common passageway for food and respiratory structures. I should say digestive and respiratory. It is divided by the soft palate. Now, the nasal cavity here, the nares are here, is made up of these turbinates that we're going to talk about, and air flows through here. But if you've ever had a sinus infection, if you've ever had what they call post-nasal drip, what happens is you have a nasal infection, you've got crud, junk in your nasal cavity, and it drips down the back of your throat or your pharynx. And so that's why sometimes the back of your throat is irritated. You feel like you have a sore throat because you have drainage. So the nasal cavity opens into the back of the throat. So there is a passageway. When an animal breathes through their nose, air is going to come in here through their nostril, come down through here, and it's going to pass into the trachea, which is right here. Now the trachea has these little bumps. The esophagus is dorsal to the trachea. So the trachea is ventral, the esophagus is dorsal. Think about E comes before T, E over T. And that is the passageway for food and water. Now, what we talked about yesterday, the larynx right here has this little flap called the epiglottis. What the epiglottis should do is when an animal swallows to eat or drink, it closes and it protects the trachea so that food and water don't go down there. But if you've ever been a person, and I have a really bad habit of talking when I eat and talk, and my kids even make fun of me. They're like, oh, mom's coughing on her food again, or she's choking. Because if you talk, your epiglottis needs to be open. Well, if you're eating and talking, there is a little opening to your trachea where food and water can get in there. And then obviously the cough is a protective reflex. So if any food or water, if someone says it went down the wrong pipe, well, those are the pipes. And the wrong pipe for food and water is the trachea. So a normal epiglottis would protect that. But again, if you're talking, your epiglottis is going to be open a little bit to allow air to move against the vocal cords. And then that's going to cause that cough. So I just kind of want you to understand a little bit of this picture, and I'm going to talk about each of these structures a little more in depth. So the nasal passages, the opening I want you to know is the nares. The nares is the term that we use in animals. So we don't really call them nostrils. I mean, some people do, but most people call them the nares. Now, the nasal passages are anything between the nares to the pharynx. So all of this right here is the nasal passages. There is a divider right here in the middle of your nose. This is called the nasal septum. So it's a band of very firm cartilage. You have a right side and a left side to your nose. So the right side of the nasal passage does not communicate to the left side. There is a nasal septum that divides the nasal passages. So you need to know the midline is the nasal septum. The nares are the openings. If you've ever seen a pug, a bulldog, any of the brachycephalic breeds, one thing that they suffer from, well, they have really big palates. They have a long palate. But the other thing is they have something called stenotic nares. Remember, stenosis is a narrowing. I can use stenosis just like effusion. I can say effusion, blah, effusion, the effusion. If I say something stenotic, it's narrow. So if a dog has stenotic nares, their nares are really narrow. That's one of the things that contributes to bulldogs and pugs and French bulldogs that have a hard time breathing. So we used to have a surgery at Purdue, and we make little cuts. We make incisions here and here, and we tack open and open up those nasal passages. I called it little doggy plastic surgery, and we're not doing it because it's cosmetic. We're doing it to help them breathe. So we can make little cuts and tack the skin, and then it'll open up their nasal passages. Sometimes we did it the same time we did palate surgery. If their palate was super long, we can go in surgically and cut back the palate. And a lot of times we would cut the nasal passages. So we would kind of do that if they're having a really hard time breathing. So the nares are the opening. You've got the nasal passages here, and they are separated by a septum. Now, if we look at them, and I don't have a skull here because I took my bones home, but I do have a skull at school that the front was kind of off, and you can see inside the bones are like swirls, and they're called the nasal turbinates. Think about a turbine. A wind turbine is circular. They're also called nasal conchae. If you've ever seen a conch shell on the beach, it's that shell that's kind of like a swirl, and you can listen to the ocean if you put it up to your ear. A conch shell has a swirl. So nasal conchae or nasal turbinates, if you look in from the front of the nose, they are literally swirled bones. Those swirled bones are lined with nasal epithelium. And remember, nasal epithelium has to be able to cool the air, humidify the air, has a ciliated lining, and creates mucus. So the mucus membranes of the bones in the nose are designed to do all those functions. Now, the only one of these three parts I want you to know is I want you to know the ventral nasal meatus. The ventral nasal meatus is an important landmark as a technician, because sometimes what we need to do is we will give an animal nasal oxygen, or we will place what's called a nasopharyngeal or a nasoesophageal feeding tube. You will basically take a very thin tube. Usually the feeding tubes, they come in different lengths. But what we will do is we'll put numbing drops. We usually use numbing eye drops, believe it or not, but we'll hold the nose back. We drop in the nasal drops, and we wait about 5 minutes. And you can do this in an awake patient. If they're really aggressive or stressing, you can give them a sedative. But what you will do is you will aim at the opening is the most ventral medial part. So it's almost like you're going along the septum. You're going to run this catheter back, but you're going to aim ventral and medial, and we lube the catheter, and we will slide it back. Now, depending on the type of tube we're putting in is how far you pass it. Okay, if we're giving nasal oxygen, we only pass it maybe so far. If we need to go down the esophagus, you're going to feed it, because look at, if on this picture, if I pass a catheter, it can go through here, ventral, it goes along here, it goes over the palate, and it should slip into the esophagus. It shouldn't go into the trachea, because technically, if something detects that it's going in here that's not air, that should close. Now, I will give you an example. If I put a nasoesophageal tube in a cat, and we're doing it for a feeding, usually we're doing it because they're not eating and we're going to give it a tube feeding. I will always give a little bit of water in the tube first, because if it did go in the wrong place, you would get a cough. So I would, if I put water, and I only use a little bit of water. If it's in the wrong place and you get some water it's not going to cause a huge deal. But I'm going to tell you, if I gave it if I pushed food into that catheter and it was in the lungs, that would be very bad. So you guys go over these tubes in Animal Tech 6. You go over like feeding tubes and stuff like that. So there's ways to check to make sure your tube is in the right place. But we never would put food in there without checking first. But the landmark to pass these tubes is the ventral nasal meatus. So I want you to understand what's going to happen is if you just look at the nose as an opening and just shove a tube back there, it's going to stop. It's going to hit those conchae or those turbinates. So you might start to pass it and it stops, and pass it. You need to aim more ventral and more medial and slide it in. Okay. So that is an important landmark that will come up later, but I want you to realize you can pass a tube back there and do tube feedings. And I can try to send you some pictures of that. So hang on one second. Hang on one second. Okay, sorry, I tell my son something. Okay, so is there any questions about that? Okay. Now, I talked about the nasal passages. The structure of the bone is these swirls. Let me go back for 1 second. The issue with brachycephalics is, this is a basic mesocephalic, dociocephalic, long nose breed. When you have a brachycephalic, all of these conchae, all of these turbinates are smushed. Okay, everything is basically, and if this is shorter, that's why the palate tends to hang or become an issue, right? This is why these dogs snore and snort and make all of these funny sounds, is because they get, everything in that is kind of shortened. You can still pass that nasal tube in those dogs. It might be a little more challenging, but that's why also the reason these turbines is they have to warm and cool the air coming in. Now, if I have a dog that doesn't have as much surface area, meaning it's shortened, they're not going to cool the air as effectively. It's one thing if you work emergency and we implore people, you have the first nice day of the year, everybody takes their dogs out for runs or fetch or a walk, and inevitably you've got a bulldog or a Frenchie or something comes in and heat stroke, because on hot days, they do not have the ability to cool the air as efficiently. They don't pant well, and they don't move air in their nasal passages. And that's a very important part of cooling them off. So they are highly prone to heat stroke. So you really, of course they want to get out with their dog, but I'm like, please, like on a hot day, you have to very, very careful and limit how much they are exposed to the sun, because they just cannot cool themselves. And that's what part of the nasal passages and the lining do. So it's pseudostratified epithelium, which has the cilia and it creates the mucus, to trap dust, pollen, any kind of particles in the air. And basically you want it to, it's supposed to warm the air, humidify it, and filter it. And that is the job of the nasal passages, by dilating and changing those vessels. Now, there are sinuses in the skull. Now, we don't deal as much with sinus issues like we do, okay? But think about this. Right here is a frontal sinus. They are ciliated outpouchings. They are related to the nasal passages, but they're kind of like air-filled pockets in the skull. The frontal sinuses are found in the frontal bone. The maxillary sinus is found along the maxilla. But if you've ever had a very bad sinus headache and you kind of go like this and you kind of push here, and sometimes you push here, it's because if they fill with mucus, they don't stretch very well. So when they start to get full, they put pressure on the bones. And this is why sometimes your teeth hurt if you have a sinus infection. The roots of these teeth right here, these are your premolars and your molar, they will actually communicate up into the maxillary sinus. And so sometimes what will happen is you'll get, like, you start chewing and it's very painful for your teeth. Let me show you something here. Oops. See if I can find it. Find a good one here. Okay, I don't know if you can see these. Can you see these pictures okay? So an interesting thing that happens is, yeah, it's small. I'm going to try to get this a little bit bigger. Is a dog will come in or an owner will say, oh, they have a little bump here. They're worried about a tumor or they're worried about a bee sting because they'll see this like red bump. Sometimes it will pop. What has actually happened here is this dog has a carnasal tooth abscess because the tooth here gets infected, and then what happens is the infection brews in that maxillary sinus. Well, the problem is the infection can't come out. The tooth is in there. So the infection is going to pop out through the top. So a lot of times owners, they might find it ruptured here and say, oh, they scratched their face, or something bit them. Let me get to maybe a better picture. This tooth is the one that's affected. Now, sometimes when I've seen this in dogs, the tooth actually looks pretty good. You'd expect to see this big, gross, rotted tooth, but it actually sometimes isn't too bad, but it can still get an infection up. Okay, hold on 1 second, sorry. Hello? Is everyone here? Sorry. I so my son was digging wire out. We had a tree planted and he was digging wire out of the ground and it stabbed into his wrist, which is wire in the ground, which is not good. So I was flushing it and cleaning it. He wasn't bleeding bad, but if you get stabbed with wire, you worry about tetanus and things. So I had to flush. Sorry. Because I didn't want it to sit and get all that bacteria trapped. Okay, so I apologize, and that's all that pause was recorded because I forgot to hit stop recording. So sorry, when you watch this video, you'll have to fast forward if you watch this video. Yes, mom duty. I was like, and I told him, I said, wear gloves. I'm worried about you digging in that wire. Be careful. And then within 5 minutes, he comes in. Yeah, I stabbed myself with the wire. And I was like, oh my God. So I had hydrogen peroxide in a syringe and I kind of put the needle in the little puncture hole and I flushed a bunch of peroxide in it and cleaned it and he was yelling. And then it started swelling from where I put the peroxide under his skin. And then I was like, oh my God, it's swelling. Why is it swelling? So, okay. Anyway, back to, yeah. All I wanted to mention, I know maybe these pictures are small and maybe I can make that a little bigger. But yeah, these are just some pictures. And so a lot of this, you can see these different pictures is, that's obviously, this is where the carnusal tooth was. And a lot of times the tooth ends up getting pulled. This one had what's called a slab fracture. So the tooth had broken off. So bacteria can migrate up into that maxillary sinus. And then sometimes they get a swollen eye. They're swollen here. And this is an abscess forming. And again, a lot of owners just assume their dog got bit on the face by a bug or, a lot of people worry about a tumor. It can be all those things, but the maxillary sinus being infected can cause an issue with that. So, okay. So I just like to bring that up. Now these sinus pouches, again, we don't deal with a lot of sinus infections, kind of like we get sinus infections in animals. Sometimes animals will have nasal discharge, can get upper respiratory infections. One thing about nasal discharge in animals that you should realize is they, the nasal discharge, if it's normal upper respiratory, usually comes from both nostrils. If animals have nasal discharge from just one side, that could also be a foreign body. That could also be a nasal tumor. A lot of our nasal tumors that we radiated, it was one of the number one cancers we radiated was dogs with nasal tumors. Some of them have been treated for 2 months with like antibiotics and steroids and, thinking that it's an upper respiratory infection or a nasal infection. But a lot of these dogs came in and it was unilateral discharge. Now, I did have a dog come into the ER with a runny nose on one side and some discharge. And when we got to talking in the history with the owner, it was a farm dog, and he liked to go in the hay bales and chase mice, and he would dive his head in the hay bales. And sure enough, when we anesthetized him and we put a scope up there, he had one of the prongs of the hay that was kind of like barbed, shoved all the way back in his nasal cavity. So we went in with a little thing and plucked it out. But one little piece of hay stuck back there. He was sneezing and pawing and discharge. And it was only from one side of his nose because there's a septum. So I would say the nasal discharge is usually a nasal issue or an upper respiratory issue. The frontal sinus doesn't cause as much of a problem. The maxillary sinus is what we see in these deeper nasal or these deeper tooth infections, so to speak. Okay. Um, okay. One part that students get confused, and I mentioned this yesterday, was larynx versus pharynx. The pharynx is the throat. That's kind of the back of our throat that we think about. The thing about the pharynx is a common passageway for food and or digestive and respiratory systems. So air moves through the pharynx, food and water move through the pharynx. It's common passageway. I always think pharynx, food first. The pharynx has a passageway for food and it comes first. It's just spelled PH, but sounds like pharynx. So pharynx, food first. It is divided into two sections, and it's not on your diagram here, but the dorsal component above, dorsal to the soft palate, is the nasopharynx. Naso meaning nasal pharynx. It's the nasal passageway. If we talk about the oropharynx is ventral to the pharynx, and that is where food and water are going to pass. So the pharynx is divided by the palate, the soft palate. Now the hard palate is up here, like the roof of your mouth. If you put your tongue to the roof of your mouth, that hard structure, that is the hard palate. If you keep going back and then it gets soft and kind of spongy, that's your soft palate. Okay, so your hard palate is in between the upper arcade of your teeth. The soft palate is behind that, and the soft palate is separating nasopharynx, oropharynx. So I do want you to know those two terms. The caudal end of the pharynx opens to the esophagus, which is digestive, and the trachea, which is respiratory. Okay, and the esophagus is dorsal to that. Now the larynx, which is what we talked about yesterday a little bit, is the voice box. Think larynx or lyric, larynx, larynx. So it connects the pharynx to the trachea. So it goes, and that's why I said first, the pharynx comes before the larynx. So the pharynx is first, the larynx is behind it, but the larynx is only supporting the respiratory structures. It is mostly a box of cartilage. It's different pieces. So there is one epiglottis, which is cartilage. You have the arytenoid cartilages, and then you have the thyroid and the cricoid. The thyroid and the cricoid are underneath. Okay. The ones that I want you to know are the epiglottis and the arytenoid cartilages, because what will happen, and the epiglottis is the most rostral, meaning it's closer to the nose. It's the first cartilage. It covers, like I said, when the animal swallows, the epiglottis is going to come up and cover the larynx. Okay, so it's the most rostral when they swallow. Okay, so it's the most rostral, covers the larynx during swallowing. Now, if we go back behind the epiglottis, the vocal cords, think of them like cords, are attached to the arytenoid cartilages. And then there's muscle that attaches to the arytenoid cartilage. So it's muscle, arytenoid cartilages, vocal folds. Now, you don't need to worry about false vocal cords. All I want you to know is the vocal cords are attached to the arytenoid cartilages. Now, if we talk about the upper airway, the larynx is obviously, it produces the voice. So when the arytenoid cartilages open and close, the muscles can pull on those cords to make the pitch higher or lower. So remember we talked about like turning a guitar string tighter or looser. It's by adjusting the tension on the vocal cords, they adjust the pitch of their bark. But the other important thing about the larynx is it prevents inhalation of any foreign debris. It controls the airflow to the lungs. So when I showed the video of that dog with the laryngeal paralysis, the larynx should open all the way, like open the curtains and close the curtains. And again, now the epiglottis will close when an animal eats and drinks. The larynx will also close. So this will close, and this will close. So they both are protective. The epiglottis is part of the larynx, but they both will protect the airway. Now, controlling the airflow, that's the issue in dogs with laryngeal paralysis, is that The problem in those guys is the curtains aren't opening all the way. Okay, instead of going like this to inhale, they might go like this. Okay, so what we do surgically, tie back one of the curtains, and then surgically that will remain open. The problem in that dog is now the only thing that can really prevent anything from going in here is the epiglottis, because the larynx, this side is permanently tied back. There's always going to be an opening. So any dog with laryngeal paralysis, whether they have surgery or not, always has a higher risk of aspiration pneumonia, because there is not complete protection of that airway, which can lead to a pneumonia and an infection in the lungs. So those dogs have to be fed. A lot of times we elevate their feedings. We feed them very slow, especially if they're a dog that like dives in their food bowl and scarfs it down. You may have to have the owner feed like a handful at a time, and or get one of those bowls where they have to like dig for their food so they don't eat everything so fast, because the faster they eat, the higher there is a risk of that pneumonia. So that's the job of the larynx. I'm going to stop here so you can get, because I want to get into the trachea and some of the lower structures. I apologize that I had to pause. Are there any questions that of anything we just talked about? You can type something.
I do. I have a question.
Yeah.
My dog was barking, so I didn't hear you. You said they're at a higher risk for pneumonia aspiration. Why? Because something's not closing and it can go down the pipe?
Well, yes. So two sides to it. If a dog has laryngeal paralysis, you either don't do anything about it or you do surgery. But if you don't do anything, the problem with the larynx, it's not opening all the way, but also the nerve or the muscle is weakened to the larynx. That's the issue. So their
Okay.
ability to collapse it very quickly is also impaired. Now, the bigger issue is they have a hard time breathing, but any dog that doesn't have full control of their larynx is at a risk of, during swallowing or eating, potentially some of that passing into the trachea. When we do the surgery, which is the second option, we take one side and we tie it. It's called a tie back. We basically pull one side permanently open. So now the dog can breathe better because we've opened it up. The problem is this side surgically cannot, it's tied. You can't pull your curtain if it's tied up, right? You got to take the tie off. You can't do that. It's permanent. So now this dog always has one side open. And then that dog is at a risk because there is an open trachea. They don't have the ability to close that larynx in a quickness. Does that make sense?
Yes, thank you.
Mhm.
Like I said, she was barking at a passerby.
Oh, no, that's, I understand. My guy does that too. So, okay. Does anyone else have any questions about any of that? Um, when I'm done here, I will convert this, and then this video will come out with yesterday's video and the homework sheet. So as long as you typed here, you're free to go. And sorry for the pause. Yeah. All right. Okay. Well, I will let you guys go. You have a good day, and I will see you guys tomorrow. I'll get that stuff sent out here shortly. Okay. Bye-bye.